Our organization started with Geraldine Thompson, a woman who lived in Monmouth County in 1912. She started out to help people live better lives, and that's what we're trying to do in the VNA today.
The VNA is a trusted brand. It is at the center of a community's caring for each other.
We have about 20 programs with nearly 200 employees, and then we have the VNACJ Community Health Centers, which have 4 sites here in Monmouth County and have about another 100 employees. So when you put those all together, we are taking care of over 55,000 people on an annual basis.
I believe that if you saw the staff at the VNA, everybody there is very passionate about what they do. And they're called by their families who they serve angels, loved like a family member. They're called best friends.
We don't have jobs at the VNA, we have callings. And each of the individuals is part of a greater purpose, a greater good. They really demonstrate and lead with their hearts. And that makes all the difference.
The VNA helps families in all stages. As children are born, they could have nursing care, they could have home visitation, or they could have some case management.
The VNA came in right from the beginning. They were in the NICU giving Jared therapy. We had PT, OT, speech, Jared had vision therapy, all from the VNA. It was like a revolving door, and they were like family.
That's all you, big guy.
It means so much to me as a dad of having that support and what they did with the VNA for us.
Through Linda and the VNA, I was able to get the therapist to come into my home and help my son. I could have never gone through this experience without her. Definitely not. Clearly, my boys could never be where they are today without the practices that were put in place, initiated by her.
To watch them grow, to have that confidence and be able to advocate for their child, that's very rewarding.
The VNA founded and evolved ultimately into what is a federally qualified health center.
From prenatal care all the way up through geriatric care and the whole spectrum of services in between. And that's really the value that the community health centers bring to our patients and to our community.
Just in the course of the last year is maybe some of the best demonstration of what the VNA is, what it stands for, and who it cares for. Last June, we opened up our LGBTQ Health Center as a core service provider to part of the community that did not receive culturally sensitive treatment in the past, notoriously.
We are the only federally qualified health center in the state that's offering specialized LGBTQ services. It's been really a long time coming.
That expansion and growth has evolved into what I would consider a really signature moment in March of 2019 when we opened up the Freehold Family Health Center. Those health centers that provide care, primary care, and multiple other services, including dental, chiropractic, mental health, behavioral health services, are the foundation of what the VNA is today.
This building here in Freehold is really our dream come true because it is a place where people can come and get a fair number of direct services, but also get connected to people who can provide many other services.
It leverages the partnerships we have with Rutgers Medical School and the Family Practice Residency Program, Central State Medical Center, which has been an important partner for us.
Here, there are women who are pregnant and children up to the age of 5 can come to get nutrition education and also get vouchers in order to get healthy foods to sustain them through their pregnancy, through breastfeeding, and through that early growth period in childhood.
We are hosting our mobile pantry. It would not be possible without the VNA. They provide us not only the space, but a lot of people volunteer their time. One family would be able to say they're visiting WIC today or they're visiting the health center for a doctor's appointment. You're getting your treatment and your care, but also this can help you manage your life in a better way to be healthier.
We all need to take care of each other. We all have this responsibility to work together to make our communities safer, healthier, and that's really the core of the mission of the VNA. We build healthy communities and enhance well-being.
The VNA has a very long and deep history in Monmouth County, and we hope that it will continue to grow.
I am excited for the VNA and its future. I just feel like it's a reaffirming time for our mission and our purpose. The legacy of the VNA lives on because of the really philanthropic community support for those programs. And that has allowed us to thrive during this first 107 years, and we look forward to that continuing for many decades to come.